Hello, this is Dr. Grande. Today's question is, what is somatic symptom disorder? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss any new videos. Now, when we talk about somatic symptom disorder, we're talking about a mental disorder in the Diagnostic and Statistical Manual, the DSM. And somatic symptom disorder is in a section called Somatic Symptom and Related Disorders. So it's in the same section as other disorders like factitious disorder, conversion disorder, and illness anxiety disorder. Now looking at the symptom criteria for somatic symptom disorder. The first one is that we see one or more somatic symptoms that are distressing or cause significant disruption. Now with Criterion B, this has a few symptom criterion under it, and only one of these have to be met. So in general for Criterion B, we see excessive thoughts, feelings, or behaviors related to somatic symptoms or health concerns. And one of the following three criteria would have to be met, although of course more than one could be met. The first is disproportionate and persistent thoughts about the seriousness of the symptoms. The second is a persistently high level of anxiety about health concerns or about the symptoms. And the third is excessive time and energy is devoted to the symptoms or to health concerns. So again, only one of these three criteria need to be met to meet Criterion B. Now Criterion C is that the state of being symptomatic is persistent. We think of this as usually more than 6 months. Now what's interesting here about Criterion C is that the somatic complaint can change over the course of these 6 months. It doesn't have to be the same somatic complaint, but just the general state of being symptomatic would be persistent for 6 months. Somatic symptom disorder also has a few specifiers. One is with predominant pain. So this is when the somatic symptom or somatic symptoms involve mostly pain. The next specifier is persistent. And for this specifier to be assigned to this diagnosis, we would see severe symptoms, marked impairment, and a long duration of symptoms. And again here, it's about 6 months or more. There are also severity specifiers with somatic symptom disorder, and they're all related to Criterion B. So that's the one that has the 3 symptom criteria and at least one need to be met. With the severity specifier mild, there would be 1 symptom. With moderate, there would be 2 or more symptoms. And with severe, there would also be 2 or more symptoms, plus multiple somatic complaints or 1 very severe somatic complaint. Somatic symptom disorder is one of those mental disorders that highlights the need to understand the distinction between a mental health clinician, someone who uses talk therapy to treat mental disorders, and a physician. A lot of mental health clinicians are not physicians. For example, I have a PhD in counselor education and supervision. I'm not a physician. So it's important that mental health clinicians cooperate with physicians on a number of mental disorders, but in particular a disorder like somatic symptom disorder, because somatic symptom disorder tends to have comorbid medical disorders associated with it. So sometimes a person could have somatic complaints of pain, for example, and there could be a medical disorder that they have that could cause those same symptoms. Another important point with somatic symptom disorder is that somatic symptoms are real symptoms. It's not that an individual is faking symptoms. They genuinely feel, for example, the pain associated with somatic symptom. The cause may be somatic, but the suffering is real. Now, there may be instances where a client is referred from a mental health clinician to see a physician, and no medical explanation can be found for the somatic symptoms. The lack of a medical explanation is not sufficient for a diagnosis of somatic symptom disorder. The full criteria for somatic symptom disorder would have to be met for a diagnosis of the disorder. Some other characteristics we see with somatic symptom disorder, there's often checking behavior, an individual checking to make sure they don't have a serious medical illness or other checking behavior, similar to the checking behavior we might see with obsessive compulsive disorder. Also, there's a need for continual reassurance, again similar to what we sometimes see with OCD. Also, sometimes individuals with somatic symptom disorder avoid physical activity. Now, there's a variety of comorbidity we see with somatic symptom disorder, including a number of medical disorders. In terms of mental disorders, we see a number of anxiety and depressive disorders comorbid with somatic symptom disorder. In terms of the cause of somatic symptom disorder, we're really not sure. We know there is a genetic component, and we believe there is an environmental component as well, including caregivers that were rejecting or neglected an individual, and we know that trauma seems to be a risk factor for somatic symptom disorder. 70% of individuals with this disorder have a history of trauma. I hope you found this description of somatic symptom disorder to be interesting. Thanks for watching.